My students tell me often, it's so hard to remember points location and how to locate acupuncture points in general. So in today's video, I have all the acupuncture points for all the 12 main meridians location. This is what we're going to do. We're going to look at all the location of all the points so you can revise them, so you can look at how we locate those points. Now, before we start talking about points location, we want to remember that it's really important to palpate the body as much as possible, to really be aware of what is happening underneath. What is your surface anatomy telling you? Where are all the veins, the ligaments, the joints, the tendons? We want to know where everything is, what muscles are on the forearm, like the extensors. Palpate. And I found that often with my students, when they are palpating, they're very gentle. If you are too gentle, you won't be able to feel what's underneath. So make sure you press hard enough so you actually feel all the tissues underneath. Does that make sense? When we locate a point, we're going to have landmark, we're going to have Tsun measurements. Now, the Tsun measurement is always tough for people to remember. You got to have to memorize that from the wrist crease to the elbow crease or cubital crease is 12 Tsun. From the anterior axillary fold to the elbow or cubital crease is 9 Tsun. You have to know those, all the one that covers the body for the limbs, for the trunk, for the head, like between the two mastoid processes is 9 Tsun, right? So all this you need to know. Now, often people say, well, okay, so the hand is 4 Tsun that can help us, right? When you look at your 4 Tsun, if I look at my hand, it should go on the interphalange of the middle finger. That's the line that it crosses for the 4 Tsun, okay? Now, the finger and hand measurement help only works for the limbs, meaning you can use them on the legs, the arms, but you cannot use them on the trunk, back or front, and you cannot use them on the head. So you have to remember that this hand helper does not work on anything but the limbs. When you use this, it has to be my hand for my body, the patient's hand for the patient's body, not your hand on the patient. So this is 4 Tsun. This is 1.5 Tsun, the length here between the width of those two fingers. The thumb width is 1 Tsun. So that helps you if you have a point that is going to be maybe 5 Tsun above the wrist. Since we know this is 12, it's obviously half, and then you have your thumb or the patient's thumb that is 1 Tsun below that. This takes practice. I'm not gonna lie, it takes a lot of practice, but understand that the more you do, the more bodies, different bodies you palpate and you measure and you practice on, the better you become at point location. Now, another thing I want to say about point location is if someone has really good chi, let's say we look at heart 7, don't think that heart 7 point itself is tiny. It is a big area. Think of this as an area of energy. Now, if someone is 84 years old and they're very depleted, very weak, it is going to be really hard to found it because the energy is going to be much more smaller. Does that make sense? But for most people that are not really depleted or very old, you're going to have leeways, okay? Not for exam. I know when you have to pass exam, but in general, you have some room. So don't feel so obsessed about, well, it's going to be a little bit to the right, a little bit to the left, right? So that's something that I want you to breathe through it. Yes? Okay. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's go. Before we start, in the description below, I have my playlist of all the meridians, acupuncture points, function, location, and my clinical pearls. That playlist is perfect if you need to review any of your meridians. I also look at the pathway of the meridian. It's very extensive for each of the 12 meridians plus the when and the do. So today I'm just compiling the point location, but if you want everything about each meridian, the playlist is below for you. Yes? Okay. First, we're going to look at the location of long 1 and long 2. So if you extend your arm forward, you're going to see the deltopectoral triangle. That's that little triangle here, that little dip, right? The clavicle is above, and you have your deltopectoral triangle. You can see the bundle here, like the ligament bundle. So long 2 is in the deltopectoral triangle, right here in this dip, and long 1 is going to be directly below. The description is 1 soon directly below long 2, but really it is directly below the bundle of the ligaments. So that's long 1 here, long 2 in the dip. Yes? Okay, let's look at their function. Long 3 and 4 are both located on the lateral side of the bicep. Remember that from the elbow crease to the anterior axillary fold is 9 soon, right? 9 soon measurement on the body measurement. So long 3 is located 3 soon below the anterior axillary fold, which means 1/3 of the way on that distance, right? And long 4 is located 1 soon below long 3, or 1/4 soon below the anterior axillary fold. And it is going to be, both of them, on the lateral edge of your bicep. So when you have your bicep here, it is going to be on the lateral edge. So it's still anterior, but it is on the edge, on the lateral side or the radial side of the bicep. So let's look at the location of long 5 to long 11. Long 5 is located at the elbow crease on the radial side of the biceps tendon, the biceps brachii tendon, right? Then if we look at long 9 is located the wrist crease on the radial artery. So be careful, there's a big caution of the radial artery. The distance between long 5 and long 9 is 12 soon. 12 soon body measurement, and we're going to use that 12 soon to locate long 6. So long 6 is located 5 soon below long 5 on the line between 5 and 9. 5 soon below long 5 on the line between 5 and 9. Next, we can look at long 8. Long 8 is 1 soon above long 9, and you can use your own thumb for your own measurement, not for your patient's measurement, to kind of help you locate the 1 soon measurement, okay? Now, long 7 is not on the line of the long meridian. It's actually more on the large intestine meridian. It's off the line, and it's on the styloid process of the radius, but just above it, right on the edge. So long 7 is 1.5 soon above long 9, which can be used to fingers to locate 1.5 soon above long 9, but obviously by the styloid process. Then long 10 is located halfway of the first metacarpal bone on the palm, but closer to the edge of the bone on the palm, and that would be long 10. And long 11 is at the base of the corner of the nail on the thumb. And those are all the location of the points from long 5 to long 11. Let's look at the location of Li1 to Li5. Li1 is located at the base of the corner of the nail, just 0.1 soon from the radial side of the base of the nail. Li2 is located distal to the second metacarpal phalangeal joint, while Li3 is proximal to the second metacarpal bone head. Li4 is halfway between the second metacarpal bone, between the first and second metacarpal bone, closer to the second one. Say that again 3 times. And Li5 is on the anatomical snuff box when you hyperextend your thumb. Now let's look at the points located between Li5 and Li11. Li11 is located at the lateral end of the crease of the elbow. All points are going to be located between 5 and 11. Li6 is 3 soon directly above 5 on the line between Li5 and Li11. 7 is located 5 soon above 5, still on the line between 5 and 11. 8 is located 4 soon below 11 on the line between 11 and 5. 9 is located 3 soon below 11. And 10 is located 2 soon below 11, still on that line. So having your elbow bent helps a lot. Make sure to remember that when you locate those points on the forearm. And that's that. Let's look at the location of Li12 all the way to 15, all on the arm. Li11 we know is at the end, lateral end of the cubital crease. Li12 on the other hand is 1 soon above Li11, closer to the edge of the humerus. Li15 is going to be located high on the shoulder, interior and inferior to the acromion. So the acromion is right here, and it's just interior and inferior to it. And the 2 points, 14 and 13, are going to be located between Li15 and Li11. Li14 is right where the insertion of the deltoid is, and it is 7 soon above 11, on the line between 11 and 15. While 13 is located 3 soon directly 11, on the line still of 15 and 11. Large intestine 16 is located between the lateral end of the scapular spine and the lateral end of the acromial head. So it is more in the back. That's the only point that's actually located in the back. Li17 and 18 are located on the side of the neck by the SCM, or the sternocleidomastoid muscle. So Li18 is at the laryngeal prominence, or the Adam's apple, between the two heads of the SCM, while Li17 is 1 soon below Li18 on the posterior border of the SCM. And that's that. Last but not least, Li19 and 20. Li19 is located at the level of Du26, which is right above the lip and below the nostrils, directly below the entrance of the nostril, while Li20 is at the corner of the ala nasi, by the side of the nostril. Pretty simple and easy. All made easy. Okay, let's look at the locations of spleen points. Spleen 1 is 0.1 soon from the base of the corner of the nail on the medial side, because liver 1 is going to be on the lateral side, right? They're very close to each other. They're both on the big toe. So that's where that's located. Spleen 2, on the other hand, is distal and inferior to the first metatarsal joints. You can see where it is on the side of the foot. And then spleen 3 is proximal and inferior to the first metatarsal phalangeal joint. So as you can see, they're both on each side, and often people have, excess skin there in the ball of the foot. So we could see it's on one side, and then spleen 3 is on the other side. Spleen 4, as you can see, is distal and inferior to the base of the first metatarsal bone. And it's often mistaken for kidney 2, which is below the navicular bone. So we have to be careful and not mix them up. And then spleen 5 is located distal and inferior to the medial malleolus. As you can see in here, it is literally very close to liver 4. So they're very close to each other. The liver are in green and the spleen points are in yellow. I just wanted to kind of show you that way you can see the difference. Spleen 6, as you can see, is 3 soon above the medial malleolus at the edge of the tibia. Spleen 7 is 3 soon above spleen 6 on the line between spleen 6 and spleen 9. And I want to remind us that the medial Tsun measurement for the body is between the medial malleolus to the popliteal crease is 15. So we want to make sure we have the right distance, right? When it comes to spleen 9, it is going to be posterior and inferior to the medial condyle of the tibia. And spleen 8 is 3 soon below spleen 9, on the same line between spleen 9 and spleen 6. So those are all the points on the leg. Spleen 10 is located directly above spleen 9. We're going to take the tutsun of the patella. That's the length of the patella. And spleen 10 is located tutsun directly above the superior medial angle of the patella. Often it's great to cup the knee and feel the bulge of the quadriceps femoris. This is how we found the point, because it is going to be on the medial edge of the quads femoris. And that's how we found the point. Easy? All right. Spleen 11 is going to be a little more tricky to locate. It is 6 soon directly above spleen 10 on the quadriceps femoris, on the line between 10 and 12, which is harder to locate, and we're going to look at it right now. So spleen 14 is kind of funny. It's 1.3 soon below spleen 15, 4 soon lateral to the midline. 1.3 soon, not very easy to locate, right? Spleen 15 is 4 soon lateral to the midline. And as you can see, spleen 16 is 4 soon lateral to the midline and 3 soon directly above spleen 15. So those points are very easy to locate. I think they're all on the belly, simple, and they all do the same thing. So let's look at that. So spleen 17, 18, 19, and 20 are all going to be located 6 Sun lateral to the midline, using the clavicle as your 8 Sun marker. And then they're all going to be in the intercostal space. So 17 is going to be on the 5th intercostal space, and 18 is going to be on the 4th, 19 on the 3rd, and 20 on the 2nd. That's pretty simple, easy, done all through the intercostal space. Locating spleen 21 starts at the 10th rib, and then you work your way up to each intercostal space until you reach the 7th and the 6th. It is on the mid-axillary line, and it either is located on the 6th intercostal space or the 7th. The one that is the most tender would be the spleen 21 for that patient. So some patients, spleen 21 is located on the 6th intercostal space, and then for some on the 7th. The most tender is always the right spleen 21. So when you locate them, it's always starting from the 10th intercostal space and working your way up. That's the easiest way to locate spleen 21. Are you enjoying this so far? Don't forget to subscribe. That's how you show me love, and I really appreciate you being here and making sure that you show me you love this content. Thank you. Stomach 5 is located at the anterior border of the masseter, which is our chewing muscle, at the level of the mandible. So it's an easy one to locate. Stomach 6 is actually going to be located at the bulge, the highest prominence of the masseter. When we clench, the masseter gets activated and there is a bulge to it. It's also 1 finger breadth from the mandible angle. Stomach 7 is anterior to the ear, and when we open the mouth, the condyloid process is going to push against our finger, and it is below the zygomatic arch, right where the condyloid process is pushed against our finger when we open our mouth, and of course anterior to the ear. Stomach 8 is 4.5 Sun lateral to the midline, 0.5 Sun anterior to the hairline, because this is 9, remember, from both angles. So that's for those points. Let's look at their functions. To locate stomach 9, 10, and 11, we have to be aware of the location and palpating where the SCM is. The SCM is the sternocleidomastoid muscle on the neck. So stomach 9 is going to be anterior to the SCM at the level of the laryngeal prominence. Laryngeal prominence, also called Adam's apple. So that's where stomach 9 is. Stomach 11 is going to be between the sternal and clavicle heads of the SCM when they insert in the clavicle and in the sternum. That's where it's going to be located. And stomach 10 is halfway between stomach 9 and stomach 11. Easy. So locating the points on the chest for the stomach meridian is going to be very easy. We're going to use the length of the clavicle from the acromion to the midline. This is 8 Sun. And so we are going to put those points at 4 Sun lateral to the midline, which means halfway on this distance. The nipple is a landmark that's often is used because it is 4 Sun lateral to the midline for men, specifically thin men. But for women, it won't work, specifically when women are laying down and they have heavy breast or bigger breast. Gravity is going to pull to the side and it is not going to be accurate. So we can't really use the nipple. Really using the distance from the acromion to the midline is your best bet to figure out where that 4 Sun lateral to the midline is, which is going to be for all the points we're going to talk right now. So stomach 12 itself is going to be located in the supraclavicular fossa. Stomach 13 is directly below the clavicle. 14 is on the first intercostal space. 15 is on the second. 16 is on the third. 17 is on the fourth intercostal space, and 18 is on the fifth intercostal space. So that's where they're all going to be located, and they are all 4 Sun lateral to the midline. We don't need all stomach 17, and for the rest of them, most of them are going to be oblique, not perpendicular. Please do not do perpendicular, as the lungs are located below the intercostal space. So let's look at those functions. So the next bunch of stomach points are all going to be located on the abdominal region, and they are all going to be 2 Sun lateral to the midline. The easiest way to do this is to look at the belly button and start with stomach 25, even though it's the last point on the way down at the belly button, right? But you start with stomach 25 and it's too soon lateral to the belly button. Now, another thing to remember is that there is a distance between the sternal angle and the belly button, which is 8 tsun, right? From the sternal angle to the belly button is 8 tsun. So stomach 19 starts 2 tsun below that, right? And all of them are going to be 1 tsun from each other going down until we reach the belly button, which is stomach 25. So those are 6 tsun that we're going to come down to with 7 points. So stomach 25 is 2 tsun lateral to the midline, of course. And that's the sternal angle to the belly button, which is 8 tsun. Stomach 19 is 6 tsun above stomach 25. Stomach 20 is 5 tsun above 25. Stomach 21 is 4 tsun above stomach 25. Stomach 22 is 3 tsun above stomach 25. Stomach 23 is 2 tsun above 25. And stomach 24 is 1 tsun above 25. And of course, 25 is at the level of the belly button. Pretty simple. Those are easy to locate. Perpendicular insertion, done. Let's look at their functions. So when it comes to the lower abdominal region, all points again are going to be 2 tsun lateral to the midline, which you can use a clavicle to take a quarter of that distance. And then we're going to go 1 tsun at a time below the belly button. Now the distance between the belly button and the upper border of the pubic symphysis bone is 5 tsun. So that's how we're going to divide it. What's interesting is some of us have very short area, and so our tsun are very small, and some of us are very long in that area, and our tsun are much bigger. So you're going to have to gauge and play with it until you figure out how to do this, because it's not that easy, I have to say. But having said that, all points are 2 tsun lateral to the midline. The distance between the belly button and the upper border of the pubic symphysis is 5. Stomach 26 is 2 tsun lateral, as we know, 1 tsun below the belly button. Stomach 27 is 2 tsun below the belly button. Stomach 28 is 3 tsun below the belly button. Stomach 29 is 4 tsun below the belly button. And stomach 30 is 2 tsun lateral at the level of the upper border of the pubic symphysis bones. So those are the points that we needle perpendicular. Let's look at their functions. Stomach 31 is at the lateral side of the sartorius muscle, on the line connecting the ASIS, or anterior superior iliac spine, to the upper border, lateral border of the patella. It's not an easy point to find. You've got to find the sartorius, but it's not too bad. It's at the level of the pubic symphysis bone as well. The next 3 points are going to be located on the line connecting the ASIS, or the anterior superior iliac spine, where her 2 fingers are on her shorts there, and then the superior lateral border of the patella. Makes sense? So you could see it from her 2 fingers, the ASIS, to the superior border of the patella. Stomach 32 is going to be located 6 tsun above the superior angle of the patella. Stomach 33 is 3 tsun above, and stomach 34 is 2 tsun above. So 6 tsun, 3 tsun, and 2 tsun directly above the superior border of the patella. Stomach 35 is going to be in the eye of the knee, on the lateral side, because Nei Shi Yan will be on the medial side. And it is located, stomach 35, on the lateral side of the patellar ligament on the knee. Does that make sense? Stomach 36 is 3 tsun directly below stomach 35. And often in clinical practice, as you can see, like my finger, we slide up until we can't go further. That's usually also a helper in locating stomach 36. And it's 1 finger breadth from the tibia crest. Stomach 37 is 3 tsun below 36, still 1 finger breadth from the tibia crest. Stomach 38 and stomach 40 are at the same level. If you remember, between the lateral popliteal crease, or the lateral side of the knee, and the lateral malleolus, that is 16 tsun. So stomach 38 and stomach 40 are both going to be halfway, or 8 tsun up, 8 tsun down, halfway of the leg distance from the knee crease to the lateral malleolus. Stomach 38 is going to be 1 finger breadth from the crest, and stomach 40 is going to be 2 finger breadth from the crest. So a little bit more lateral. Makes sense? You could see that. Stomach 39 is one soon directly below stomach 38. And you see my boomer coming into play because, of course, he's very curious and he has to know what's going on. And stomach 41 is on the ankle crease, as you could see with the boomer in the picture, which I think is fantastic. So on this video, I went backwards just for fun. Stomach 45 is 0.1 soon lateral to the second toe on just the corner of the nail. You could see that. Stomach 44 is half a soon above the web margin between the second and third toe. Then we have stomach 43, which is going to be distal from the junction of the second and third metatarsal bone. And then we have stomach 42, which is on the highest part of the foot, or the dorsum of the foot. We have to watch for the dorsal pedis artery in there because you can feel the pulse underneath. So be very mindful when you needle stomach 42. And it is going to be between the two tendons, the digitorum longus and the hallucis longus, which basically flex your toes and your big toe. And those are the location of all the points on the stomach. Woohoo! Let's look first at the location of heart 1, 2, and 3. A quick reminder, between the elbow crease and the axilla, the anterior axilla, it is 9 soon, right? Your whole arm from the elbow to the axilla is 9 soon, just a reminder. So heart 3 is located at the medial end of the elbow. Heart 2 is located 3 soon above heart 3, right at the edge of the biceps, the medial edge of the bicep. And then heart 1 is located at the center of the axilla. Pretty simple. Let's now look at the locations of heart 4 to heart 9. Heart 4, 5, 6 are going to be in relationship to heart 7. Heart 7 is at the wrist crease, as you can see there, on the radial side of the flexor carpi ulnaris, which I'm going to be called FCU. Much easier than say flexor carpi ulnaris every single time. You with me on this? Okay, so we see heart 7 in relationship to heart 4 is 1.5 soon above heart 7. 1.5 soon is 2 of the patient's fingers. The first 2 fingers, that's 1.5 soon. So you can use that to help you. And all those points, 4, 5, 6, 7, are all going to be on the radial side of the FCU, right? So heart 4 is 1.5 soon above, heart 5 is 1 soon above, heart 6 is half a soon above. Make sense? And then heart 7, of course, at the wrist crease. Heart 8 is located between the 4th and 5th metacarpal bone on the palm. And it is really found by forming a fist and gently resting the baby finger where your baby finger lands. That's literally where heart 8 is. And as you can see, heart 9 is 0.1 soon at the base of the corner of the nail on the radial side of the baby finger. Small intestine 1, as you can see, is at the base of the corner of the nail on the ulnar side, while heart 9 is on the radial side at the base of the corner of the nail. Small intestine 2 is distal to the 5th metacarpal bone, and small intestine 3 is proximal to the 5th metacarpal head. Small intestine 3 also, if you look at your hand, there's always a line here. When you make a fist, there's a line. This line is exactly where small intestine 3 finishes. So for me, if I go along the line, this is where small intestine 3 is. When we needle it perpendicular, straight in, through. So often it'll go through quite deep, and I've had that point done on me many times. It is pretty powerful because of where it's located specifically if you need it. Now let's look at small intestine 4. Small intestine 4 is between the hamate bone and the 5th metacarpal, right on the ulnar side of your wrist, while small intestine 5 is on the other side between the triquetral bone and the styloid process of the ulna, both on the wrist area. And then what's funny about small intestine meridian is small intestine 6 kind of diverge and is not along the ulnar side of the arm, but it's more in the back, in the posterior side, right on the radial side of the styloid process of the ulna. Often when I was in school, our teacher would show us that if you put your finger or your index finger on your styloid process and then you turn like this is where your finger ends. That's where, again, we start here and then we turn, and then that's where small intestine 6 finishes or is located. Small intestine 7 is located on the line between small intestine 5 at the wrist and small intestine 8 at the elbow. It is 5 soon above 5 on that line. Small intestine 8 is located between the olecranon and the medial epicondyle of the humerus. Now we're going to look at the location of the small intestine acupuncture points all on the upper back area. Starting with small intestine 9, which is located 1 soon directly above the posterior axillary fold. Small intestine 10 is directly above small intestine 9, just below the acromion. So you slide your fingers until you feel the acromion. Small intestine 11 is located on the scapula. And if you look at the scapula, it forms kind of like a little bit of a triangle. And small intestine 11 is located on the upper third of this triangle, from the lower tip to the upper part. It's on the upper third if you separate or divide it by 3. And it is right in the center. Small intestine 9, 10, and 11 form a triangle with equal sides. So that helps you. If you found 9 and 10, you can find 11 because this is a triangle that has equal 3 sides. All right, so now let's look at 12. Small intestine 12 is directly above small intestine 11 in the supraclavicular fossa. Then we have small intestine 13, which is located halfway between small intestine 10 and the lower spinous process of the second thoracic vertebrae, or T2. And then small intestine 14 is 3 soon lateral to the lower border of the spinous process of T1. And small intestine 15 is 2 soon lateral to the spinal process of C7. So that's a little bit of a zigzag there. Use a lot of practice to palpate all the vertebrae. It will help you tremendously. So keep practicing finding the vertebrae. Now let's look at the small intestine acupuncture points located on the neck and head. Small intestine 16 is located in the posterior border of the SEM, sternocleidomastoid, at the level of the laryngeal prominence. Small intestine 17 is right in front or anterior to the SEM at the level of the mandible, the jaw angle. Small intestine 18 is located directly below the outer canthus and at the level of the lower part of your nostrils, on the cheek or the zygomatic arch. And the last one is small intestine 19, which is located right on the tragus, which is a point that is next to gallbladder 2 and San Jiao 21. Those 3 points are all located on the tragus. Now, one of the things I wanted to say is a lot of people always say to me, Clara, do you have a video on this? Do you have a blog post on high blood pressure? Do you have a video on low back pain? Do you have a course on fertility? Well, if you are on my email newsletter, you would have access to all this content in your inbox, so you would not miss out on anything. And on that newsletter, I share tips and tricks that I don't share anywhere else. So if you're not on my email newsletter yet, get on it now. The link is below. It's completely free and you will get so much more out of it. Now, let's go back to points location. So let's start with the location of kidney 1. It's underneath the sole, which is not an easy point to needle. That's why doing moxa is often much more easier for patients because, yikes, there's a lot of nerve ending on the sole and it can be really, really powerful for a lot of patients. And I have one of my patients that loved this point. The first time I did this point on him, boy, oh boy, he was pretty surprised. Even though I told him, this is a very powerful point, he's like, no, I want to try it. And he absolutely benefit from it. And we're going to talk about the function in a minute. But first of all, let's look at its location, which is really on the sole of the foot. If you look at the sole, you divide this in 3 parts. And kidney 1 is on the upper third part, right between the second and the third metatarsal. And usually when I needle it, I needle towards liver 3. That is oblique and towards liver 3 to connect with liver 3. It's a perfect way to use kidney 1. Kidney 2 is located on the lower border of the navicular bone, which often is mistaken for spleen 4. So we really want to find that navicular bone, which is kind of protruding for a lot of people, and just go inferior to it. Kidney 3 is really important to locate properly because all the points that are around it are going to be depending on where kidney 3 is. So kidney 3 is located halfway between the Achilles tendons and the prominence of the medial malleolus. Kidney 4 is half-atsun posterior and inferior to kidney 3. Remember, from kidney 3, or from the prominence of the medial malleolus, to the bottom of the foot or the sole is 3 tsun. So we want to divide this by third, and this is how we can find kidney 4 and kidney 5. Kidney 5 is directly 1 tsun below kidney 3. It's that 1/3 that we can divide between the malleolus and the bottom of the sole of the foot. Kidney 6 is 1 tsun directly the prominence of the medial malleolus, just between the two ligament bundles. Kidney 7 is easy. It's just 2 tsun directly above kidney 3. And kidney 8 is half a tsun anterior to kidney 7. So 2 tsun above the medial malleolus and half a tsun anterior to kidney 7. And kidney 9 is 5 tsun directly above kidney 3 on the line between kidney 3 and kidney 10. Kidney 10 is located in the back of the knee at the medial end of the popliteal crease between the two tendons, the semitendinosus and the semimembranosus of the tendon of the hamstring. Let's look now at the location of kidney 11. We're starting half a tsun from the midline below the belly button. Kidney 11 is half a tsun lateral to the midline, 5 tsun below. Kidney 12 is 4 tsun below. Kidney 13 is 3 tsun below. 14, 2 tsun below. 15, 1 tsun below. And 16 is at the level of the belly button, half a tsun lateral. All those points we have to remember are located between the belly button and the upper border of the pubic symphysis bone, which that is 5 tsun in distance. Let's look at the belly again. Now we start with kidney 17 being 2 tsun above the navel, half a tsun lateral. Kidney 18 is 3 tsun above the navel, half a tsun lateral. 19 is 4 tsun, 20 is 5 tsun, and kidney 21 is 6 tsun above the belly button, half a tsun lateral to the midline. So it starts 2 tsun above. Remember that with kidney 17, and we go all the way to kidney 21. So when it comes to kidney 22 to kidney 27's location, we're going to use the length of the clavicle from the acromion to the midline, which is 8 tsun, right? So we start at kidney 22, which is on the 5th intercostal space, 2 tsun lateral, which means a quarter of the length of the clavicle. And then kidney 23 is on the 4th intercostal space. Kidney 24 is on the 3rd intercostal space. Kidney 25 is on the 2nd. Kidney 26 is on the 1st. And kidney 27 is on the lower border of the clavicle, 2 tsun lateral to the midline. Bladder 1 is 0.1 tsun above the inner canthus. And bladder 2 is at the medial end of the eyebrow. Bladder 3 is located directly above bladder 2, half a tsun from the anterior hairline. Now the next group, 4, 5, 6, 7, and 8, are all located 1.5 tsun lateral to the midline. Bladder 4 is half a tsun within the anterior hairline. 5 is 1 tsun. 6 is 2.5 tsun. 7 is 4 tsun. And 8, 5.5 tsun from the anterior hairline. Bladder 9 is 1.3 tsun lateral to Du17 or the occipital protuberance border. And bladder 10 is 1.3 tsun lateral to Du15 or half a tsun within the posterior hairline. The next group of points is pretty easy. They're all 1.5 tsun lateral to the midline. Bladder 11 is at T1. Bladder 12 is at T2. And as you can see here, bladder 13 is T3. Bladder 14, T4, bladder 15, T5, 16, T6, and 17, T7. That's pretty easy because they're just following the spinous process, and it's always on the lower border of the spinous process. I wanted to show you how I needle the back shoe point of the upper back because in general, we go downward so we can catch more than one point at a time, but some people go towards the midline. Either way is great. Bladder 18 is 1.5 Tsun lateral to the midline at the level of T9, or the border of the spinous process of T9. And then we continue down all the way to bladder 26, which is located at the lower border of L5. And then bladder 27, 28, 29, and 30 are all located 1.5 Tsun lateral to the midline at the level of the first, second, third, and fourth sacral foramen. Now, the next line is bladder 31 to 34, and they are all located within the sacral foramen, 1, 2, 3, and 4. And bladder 35 is located 1/2 Tsun lateral to the coccyx. Bladder 36 is below the gluteal fold, right in the center of it. And from the gluteal fold to the popliteal crease is 14 Tsun, right? Well, bladder 37 is 6 Tsun below bladder 36 on the line between 36 and 40. Bladder 38 is 1 Tsun above bladder 39 on the medial side of the biceps femoris tendon. Bladder 39 is lateral to bladder 40 on the popliteal crease medial side of the biceps femoris tendon. Bladder 40 is definitely at the center or the midpoint of the popliteal crease. Bladder 55 is 2 Tsun below bladder 40. Bladder 56 is 5 Tsun below bladder 40 on the line between 55 and 57. Bladder 57 is 8 Tsun below bladder 40 on the gastrocnemius body tip. And bladder 58 is 7 Tsun above bladder 60, 1 Tsun inferior and lateral to bladder 57. I just wanted to show you how I needle bladder 57 perpendicular, and I like to stimulate it. It's such a great point for hemorrhoids, and this is how I stimulate: very fast, up and down, and then kind of twirling back and forth. Bladder 60 is halfway between the lateral malleolus and the Achilles tendons. Bladder 61 is below bladder 60 on the calcaneus depression between the white skin and the dark skin. Bladder 62 is below the lateral malleolus tip. Bladder 63 is anterior and inferior to bladder 62, and it's inferior to the cubital bone depression. Bladder 64 is proximal to the fifth metatarsal tuberosity. Bladder 65 is proximal to the fifth metatarsal head. Bladder 66 is in the depression distal and inferior to the fifth metatarsal phalangeal joint, and bladder 67 is 0.1 Tsun lateral to the fifth toenail corner. Yay! Pericardium 1 is 1 Tsun lateral to the nipple in the fourth intercostal space. The distance between the anterior axillary fold and the cubital crease is 9 Tsun. So pericardium 2 is 2 Tsun below the anterior axillary fold between the two heads of the biceps brachii muscle. Pericardium 3 is on the transverse cubital crease on the ulnar side of the tendon of the biceps brachii, while lung 5 is on the radial side, so they're really next to each other. Pericardium 4 is 5 Tsun above the wrist crease between the palmaris longus and the flexor carpi radialis. Pericardium 5 is 3 Tsun above the wrist crease, still between the palmaris longus and the flexor carpi radialis. Pericardium 6 is 2 Tsun above the wrist between the palmaris longus and the flexor carpi radialis. Pericardium 7 is at the wrist crease on the radial side of the flexor carpi radialis. Pericardium 8 is between the second and third metacarpal bone on the palm. When making a fist, the point is where the middle finger gently rests. And pericardium 9 is in the center of the tip of the middle finger. San Jiao 1 is located at the lateral side or ulnar side of the ring finger at the base of the nail, 0.1 Tsun from the base of the corner of the nail. Easy one, right? San Jiao 2 is located between the fourth and fifth finger at the web margin. San Jiao 3 is located between the fourth and fifth metacarpal, proximal to the metacarpal phalangeal joint on the dorsum of the hand. San Jiao 4 is located on the ulnar side of the extensor digitorum communis, which is on the dorsum of the wrist. San Jiao 5 is one we use a lot in clinical practice, and it is 2 Tsun above the dorsum part of the wrist between the ulnar and the radius. San Jiao 6 is located 3 tsun above the wrist between the radius and the ulna. San Jiao 7 is also 3 tsun above the wrist, but it is on the radial border of the ulna. So a little bit more towards the ulna area, so more lateral. San Jiao 8 is 4 tsun above the wrist on the dorsal part of the forearm between, again, the radius and the ulna. And San Jiao 9 is 7 tsun above the wrist, again, between the radius and the ulna. And remember that from the wrist to the elbow is 12 tsun. So it's a little bit more than halfway on San Jiao 9. San Jiao 10 is 1 tsun above the olecranon, and San Jiao 11 is 1 tsun above San Jiao 10. San Jiao 12 is halfway between San Jiao 11 and San Jiao 13. San Jiao 13 is 3 tsun below San Jiao 14 on the posterior border of the deltoid. San Jiao 14 is in the depression inferior and posterior to the acromion when the arm is abducted. And then we can see large intestine 15 as the blue dot, which is anterior, and San Jiao 14, which is posterior. Make sense? Those are really next to each other and they really work well together. San Jiao 15 is halfway between gallbladder 21 and small intestine 13 on the superior angle of the scapula. San Jiao 16 is on the lateral side of the neck on the posterior border of the sternocleidomastoid. It is at the level of the mandible and on the posterior border of the mastoid process. As you can see, the little green dot is between gallbladder 12 and San Jiao 17, which is below the earlobe. To give you a little bit of a reference point, I have located also the gallbladder points that are at the same area of the San Jiao, so you can see the difference. I think it helps to have a perspective. So San Jiao 17 is posterior to the earlobe between the mastoid process and the mandible angle, as you can see in the lower part. San Jiao 18 is in the junction of the middle and lower third of the curve formed by San Jiao 17 and at the top San Jiao 20. And San Jiao 19 is in the junction of the middle and upper third of the curve formed by San Jiao 17 and San Jiao 20. And as you can see, San Jiao 20 is directly above the ear apex within the hair line. San Jiao 21 is located often when the mouth is open. It's anterior to the tragus of the ear and posterior border of the condyloid process of the mandible. San Jiao 22 is anterior and above to San Jiao 21 at the level of the auricle root, where the superficial temporal artery is. So we have to be really cautious when we needle this point because of the temporal artery. And of course, San Jiao 23 is at the lateral end of the eyebrow. Liver 1, as you can see, is on the base of the toenail, 0.1 tsun. However, it shouldn't be saying the medial side of the toenail, it should be the lateral, because the medial side would be spleen 1, which is the yellow dot there. So spleen 1 is on the medial side and liver 1 is on the lateral side of the base of the toenail, 0.1 tsun. Now liver 2 is between the first and second metatarsal, half a tsun from the web margin. Liver 3 is located also between the first and second metatarsal, but 1 tsun from the web margin. Liver 4 is anterior to the medial malleolus and often is mixed with spleen 5. Spleen 5 is inferior and anterior to the medial malleolus, while liver 4 is just above it because it's anterior to the medial malleolus, but it's also located right medial to the tibialis anterior tendon. Liver 5 is 5 tsun directly above the medial malleolus, but anterior to the spleen meridian, so closer to the edge of the tibia. Liver 6 is the same, is close to the edge of the tibia, but 7 tsun directly above the medial malleolus. And remember that between the medial malleolus to the knee crease or popliteal crease is 15 on the medial side, 16 tsun on the lateral side. Liver 7 is 1 tsun posterior to spleen 9, and spleen 9 is directly below and posterior the epicondyle of the tibia on the medial side of the leg. And liver 8 is at the medial end of the popliteal crease or medial end of the knee crease when we bend the knee. Spleen 10 is located too soon directly above the patella medial upper border. However, liver 9 is located fourth soon above the femur epicondyle on the medial side, between the sartorius muscle and the vastus medialis. We can feel that it's pretty tender on a lot of people. Liver 10 is located 3 soon directly stomach 30. Stomach 30 is 4 soon lateral to the upper border of the pubic symphysis. And liver 10 is also located at the lateral edge of the abductor longus muscle. Liver 11 is the same, is 2 soon directly below stomach 30 on the lateral border of the abductor longus. This is why it's a tricky point, but liver 12 is 2.5 soon lateral to the midline, right below stomach 30, and it is where the femoral artery can be palpated, so a little dangerous. Liver 13 is directly below the free end of the 11th rib. Liver 14 is located on the 6th intercostal space, 4th soon lateral to the midline. If you use the clavicle, which is 8 soon, you go halfway down and reach the 6th intercostal space. That's where liver 14 is.
GB1 is half a soon lateral to the outer canthus. GB2 is interior to the ear tragus. GB3 is directly above stomach 7 on the upper border of the zygomatic arch. GB4, 5, 6 are all located on the temporal area on the curve connecting stomach 8 and gallbladder 7. GB7 is interior and superior to the auricle at the level of the ear apex. GB8 is 1.5 soon directly above the ear apex. GB9 is half a soon posterior to GB8. GB10 and 11 are all within the hairline and within the curve connecting GB9 and GB12. GB12 is inferior and posterior to the mastoid process. GB13 is 3 soon lateral to the midline and half a soon within the anterior hairline. GB14 is 1 soon directly above the eyebrow midpoint. GB15 all the way to GB18 are all located at 2.25 soon lateral to the midline. GB15 is half a soon within the anterior hairline, 16 is 1.5 soon, 17 is 2.5 soon, and GB18 is 4 soon within the anterior hairline. GB19 is 2.25 soon lateral to the midline at the level of the occipital protuberance. GB20 is half a soon within the anterior hairline, halfway between the sternocleidomastoid and trapezius muscles. GB21 is on the highest point of the shoulder, halfway between the acromion and the spinous process of Du 14. Let me show you how I needle gallbladder 21. I think a lot of people really worry about needling it because the ear apex is below, and that makes sense. However, if we grab the muscle, the trapezius, and we needle towards the back of the body, I was taught to needle towards the back in a way that was oblique or transverse, depending how big the person or the patient is. I hope the needling of this really, truly helps you. GB22 is 3 soon directly below the axillary midline on the 4th intercostal space. GB23 is 1 soon anterior to GB22, still on the 4th intercostal space. GB25 is located at the free end of the 12 floating rib. GB26 is below liver 13, 2 soon above the navel at the free end of the 11th rib. GB27 is 3 soon directly below the navel on the border of the anterior superior iliac spine. And GB28 is on the border of the anterior superior iliac spine as well, half a soon inferior and interior to GB27. GB29 is halfway between the ASIS, or anterior superior iliac spine, and the prominence of the greater trochanter. GB30 is located between the sacral, hiatus, and the greater trochanter. It is 2/3 to the medial line that really connect those two entities. GB31 is 7 soon above the popliteal crease on the lateral side of the thigh, and often to located, we can just have the person landing gently, normally, the middle finger on the iliotibial band, and that's where usually gallbladder 31 is located. Gallbladder 32 is 5 tsun above the popliteal crease on the lateral side of the thigh. GB33 is 3 tsun above GB34, lateral to the knee joints, above the external epicondyle of the femur. GB34 is interior and inferior to the head of the fibula. Now, this is really easy because you can feel the head of the fibula and you can feel also the tibia head as well. And it's between the two. Needling gallbladder 34 is so efficient, and I just wanted to show you how I do that because it's fun to needle, right? We all love it. GB39 is 3 tsun above the lateral malleolus on the posterior border of the fibula. And GB38 is 4 tsun above the lateral malleolus, still on the interior border of the fibula. GB37 is 5 tsun above the lateral malleolus. GB36 is 7 tsun above the lateral malleolus, but on the anterior border of the fibula. GB35 is 7 tsun above the lateral malleolus on the posterior border of the fibula. And GB44 is on the lateral side of the fourth toe, 0.1 tsun from the base of the corner of the nail. GB43 is between the fourth and fifth toe, proximal to the web margin. GB42 is between the fourth and fifth metatarsal bone, lateral to the extensor digiti minimi, 1 tsun from the web margin. GB41 is distal to the fourth and fifth metatarsal bones, lateral to the extensor digiti minimi. GB40 is in the depression anterior and inferior to the lateral malleolus on the lateral side of the extensor digitorium longus.
Wow, that was a lot of points. You can go back to this video anytime and the timestamps are below. So if you just want to review, let's say the gallbladder points, then look below because you can just click on the gallbladder and it'll take you directly there. So if there's something that takes a little bit longer for you to review, you have the possibility to look at it below. In the meantime, here's the playlist of all the meridian that you can watch with all the function, location, pathways of the meridian, and my clinical pearls. No matter what, have a fantastic day and keep rocking it using TCM because after all, acupuncture rocks!